So the current gold standard for the treatment of aortic dissection is an emergent hemiarch repair plus or minus root surgery, as we've heard. Unfortunately, due to the friability of the aortic tissues, there's often commonly a new distal anastomotic entry tear which permits true false lumen perfusion. This antegrade pulsatile flow and pressurization of the false lumen can result in ongoing malperfusion issues and aortic growth, most commonly in the aortic arch and the proximal descending thoracic aorta. The current gold standard hemiarch for the treatment of acute type A aortic dissection often results in this de novo distal anastomotic new entry tear with subsequent pressurization of the false lumen and negative aortic remodeling. Additionally, malperfusion may be a significant life-threatening issue. So these images depict the most common repair and demonstrate how a tear at the distal anastomosis can result in the common observations of growth within the arch and the proximal descending thoracic aorta. Today's standard of care fails to exclude this new tear, leaving the false lumen untreated in up to 50 to 70% of cases, despite our best efforts of addressing the distal anastomosis. Pressurization of the false lumen with persistent entry tear leads to ongoing true lumen collapse. The development of a distal anastomotic tear is common due to friability of the aortic tissue and is not a failure of surgery. This allows pressurization of the false lumen, and we can see in the picture on the right the false lumen continuing to expand, which is a common finding on all of our postoperative CT scans. The Ascyrus medical dissection stent, the AMDS, bridges this treatment gap without adding complexity to the current standard of care. The proximal cuff and the implantation technique both act to decrease the likelihood of the development of a distal anastomotic new entry tear, and the uncovered stent allows for flow and access to all of the major aortic vessels. Additionally, it acts to help expand the true lumen to its proper size. The AMDS aims to abolish the antegrade pulsatile flow into the false lumen, and these cells, which you can see, definitely allow excellent perfusion to the head vessels and, if necessary, intervention into those vessels.